welcome everyone. Today, Linda and I would like to introduce you to our guest, Dr. Avi Charlton. Avi is a GP based in Melbourne who is also a low-carb specialist. So thank you so much for your time, Avi, and we're really looking forward to hearing what you've got to say. And yeah, we'll hopefully learn lots from you as we go. So thank you.
Thanks, Dr. Avi. Thank you for coming on. Really appreciate it.
Thank you. Thank you for having me, Linda and Vicky.
Okay, so let's get started with some questions. So I suppose what's the one we want to know is sort of what initially drew you to medicine, and how did your career lead to going down, I suppose, a low carb nutrition way of eating?
Yeah. I came out of year 12 and I got into medicine. So back then, 20 or almost 30 years ago, it's a pre-med, no, not pre-med, it's an undergraduate course. So you go straight from year 12 to medical school. Like a lot of medical students that go into medical school, we all want to help people. We want to treat people. We want to heal the world, and we want to make the world better by healing the world. So I went through medical school 6 years. I did my hospital years and became a GP, got married, had kids, and just a usual routine. After having kids, maybe about 5 or 6 years after having kids, I wanted to get fit. What happened was, in my clinic, one of the patients looked at me and said, "Oh, are you pregnant again?"
Oh,
And I wasn't. I was about maybe 3 or 4 years after having kids.
right.
That was drastic, and I felt terrible. I don't want to be a fat doctor. So I decided to join the gym. And I did an 8-week body transformation challenge. The trainer put me on a diet which has got a spreadsheet that I had to weigh up protein and fat and carbs. And turns out I was in ketosis, and that was a low carb diet. And I looked into it more. I went to Low Carb Down Under talks for doctors and learned more, and did nutrition network to educate myself. And I've come to this amazing journey of low carb, ketogenic diets, therapeutic carbohydrate restriction, and helping a lot of patients lose weight and gain health. So that's basically how I came to the low carb space.
So, Avi, do you think your turning point was that comment from the patient about "Are you pregnant again?" where you decided that you really needed to change something?
It probably was, but I was tired and chubby, and I didn't really look into my health that much. But I was thinking about joining the gym a bit. Even when I joined the gym, I had no clue that I can improve my health just by eating good foods. I
It's
just
amazing,
I just did the 8-week transformation challenge because they marketed it well, and I thought it would be fun to do it with the gym people. Yeah, so that was
And
great.
Dr. Avi, do you think people get confused about low carb diet as opposed to a keto diet? Because do you think a lot of people think they're the same? And can you maybe explain the differences between those?
Yeah. A lot of people they do get confused, and they're not sure which one to go. Sorry about my dog who's barking in the background.
Oh, I didn't even hear it.
Oh no, you can't hear it?
No.
No.
Oh, good. So ketogenic diet is a state where your body burns ketones. Usually it's very, very low carb. We usually say it's usually less than 20 grams a day of carbs. Then you switch your body fuel system to burning ketones. That's a keto diet, and it's actually a body state rather than a diet. Whereas low carb diet is lowering your usual carb intake to maybe around less than 50, which doesn't get you into ketosis yet, but pretty good. And quite a lot of people will burn fat because they're lowering quite a lot of carbs. Compared to the usual standard diet is 200 to 300 grams of carbs a day, or even more than that. So I usually tell people keto is fantastic. If you can get very low carb into a ketogenic diet, that's amazing, and you'll reap the benefits of having ketones. But even if you don't do keto, if you do low carb, less than 50, that is fantastic as well.
Mm.
And a lot of people will get good results with going low carb. Yeah, so that's how I usually explain to people.
So I'm just wondering if you've had any or much resistance from either patients or other doctors around this bit different approach to how you treat illnesses.
Yeah, absolutely. Even my close girlfriends, and there's a pediatrician and there's architect, they're all well-educated girlfriends, and they're not ready to go low carb. They look at me
Mm.
and they don't know, they don't want to know. And when I post on GP Facebook groups about the amazing effect of low carb and reversing people's obesity and diabetes,
Mm.
they just have lots of kickback and knockback and saying, oh, it's not sustainable. It doesn't usually work in the long run, or they have negative comments that it's inflammatory. I think when they say it's non-sustainable is because they can't give up their carbs themselves.
Or they've
They just,
decided they don't want to.
that's right, or they don't want to
Mm.
look into it, they don't want to give up, and they have to stick to the standard diet, or they haven't gone into a rabbit hole because they haven't had their own personal health journey
Yeah.
that they need to
Mm.
reverse.
Mm.
What
And
about with patients?
Patients, sometimes I do get some patients that are keen to learn more, but some patients, they would rather die, and that's exactly what they say. They can't give up their
Mm.
carbs.
oh,
So yeah.
that's a bit upsetting, isn't it? That they'd rather
Mm,
die.
yeah, I know, yeah. But I think if I've given them the options, that they can have a choice whether they want to do lifestyle or whether they want to take a pill or go
Mm.
injections, then they're informed that this is a modality, therapeutic modality that they can adopt.
Yeah,
I know someone that I spoke to a while back who's a GP. He
Mm.
doesn't necessarily do low carb per se, but he said he always spoke to new patients about diet and lifestyle. But he said that he felt that 9 out of 10 people would rather keep eating what they're eating and just take a pill when they get sick.
Yeah, agree. A lot of patients are like that.
Mm.
But sometimes some doctors don't give them a lot of information and they just say,
Mm.
oh, eat less, move more, improve your diet.
Mm.
And that is
That's
just
very
not very,
vague.
yes,
Mm.
not very specific advice to the patient. The patient's heard it, they've tried it, doesn't work.
Mm.
They don't know what to do when they hear this advice. Some people actually do listen, go to the gym, smash themselves, work really hard, eat very little, and they don't lose weight.
Mm.
Mm. And
Doesn't work.
Exactly.
yeah, do you find that some people just don't understand low carb? Because I think some aren't willing to change because they think, I'm never going to eat a piece of bread again. I'm never going to eat a cake again. And, do you think that you can incorporate, a small amount of carbs once you've lost weight and you're in a healthy state? Or, incorporate sort of, I suppose, the unhealthy carbs
Mm.
occasionally? Or do you think that your way of thinking is that you never touch them?
It really depends on the person. Some people will be sticking onto it, and those who are diabetics or they really want to lose weight, depending on what they want out of this and how they frame their mindset, it will work according to how they think of it. So if they really want to lose weight, reverse diabetes, the more they stick to low carb, then they get better results. But
Mm.
once they achieve their weight goal, or if they reverse the diabetes, if they have some treat, some cake once every now and then, it's probably
Mm.
not a big deal.
Mm.
Mm. Yeah.
As long as the majority of the time they still eat good foods and nutritious
Mm.
foods.
Yeah,
So
I
have
know.
you got,
Sorry, I know you
sorry.
shared with us a while ago, to use a glucose monitor to actually measure. And I actually got one when you suggested this. And I think anyone that's not sure about carbs, when they
Mm,
wear one of these, it's absolutely amazing because you can see
mm,
your body in real life and you can see exactly what's happening. It's not a doctor telling you or a health coach telling you. You can see.
yeah.
and then it's up to you whether you want to eat those foods. So could you talk a little bit more about the benefits of a glucose monitor?
Yeah, absolutely. Yeah. So we're talking about either a continuous glucose meter, which you can stick on your body and wear it 24 hours a day.
Mm-hmm.
You can also do finger pricks and do blood sugar glucose finger pricks as well. So the benefits of a continuous glucose meter is that you can see the blood sugar in real time. And if you eat something and it spikes your blood glucose, then you know that food is too much glucose or too much carbs. There was a trial, not trial, you can get a discounted price trial from Dexcom or Freestyle Libre for $15 for 2 weeks. And when I got the Dexcom, it was $10 for 30 days. And that is an amazing price. And you can get one to, yeah, so cheap. You can get it to try for yourself. And after 2 weeks, you probably know what food is spiking your sugars and what food's better for you. And it's an eye opener because a lot of people think eating oats and pigs is healthy and
I know, yeah.
and pasta and spaghetti and rice and
Yeah.
those sort of foods. So you can see what it's doing.
So we work with women over 50. So for a long, long, long time, we've been told that, you know, fat is evil. I remember following, closely the Nathan Pritikin cookbook when I had young children because he was kind of the guru of the low fat.
Yeah.
So I guess one of the biggest challenges that Linda and I've got is getting women our age to change that mindset. So have you got any like secret, ways that we can do that? Or have you got anything that's worked successfully for you around getting people to understand that what they've been told for such a long time might not be actually correct?
Yeah. I try to tell them to focus on the healthy fat rather than any fat. So we talk about healthy fats such as avocado, nuts and seeds, and they all agree with that. And olive oil, coconut oil, and we talk about staying away from this vegetable oil, seed oil, margarine. Most people have no problem with that. And then I introduced even the fat around the meat is fantastic. Even butter is good. And cheese is fine. Then I usually talk about brain health, that the brain is made out of mostly fat. And if you go low fat, then quite often you can have mental health problems. And fat is essential for our brain health, essential for our hormones and immune system. And going low fat is detrimental to our health because low fat quite often is higher carbs. And look what happened to our society. Like everyone's overweight and everyone's got obesity and diabetes. So sometimes it works, sometimes some people still want to go low fat and they can't bear eating
it's
fat.
a hard mindset to shift, isn't it?
But I usually focus on the avocado and the nuts and seeds and olive oil, and they're happy with those.
Yeah, I think though that too, what I find that people don't understand is that those vegetable oils are in nearly every single food in the middle aisles of the supermarket. And I've even seen with my own family, the younger generation and probably even our generation, but you buy packets for convenience and bars and things for convenience. And even people think they're having, plant-based milks, and if they go get a cappuccino, and I've checked them all out, and 95% of all plant-based milks actually have vegetable oil in them. And I don't think they can easily change the vegetable oils they might put on their salads, but I don't think they're actually thinking that, these oils are actually in all these processed foods that they might be eating.
I agree, because they marketed that oat milk and soy milk are fantastic, better than the dairy. And they don't realize it's all those ingredients and it's actually processed foods and vegetable in the oats milk.
Yeah, definitely.
It's a big tide to turn, isn't it? To get people to really understand Yeah. I mean, Linda and I have been doing it for some years now, and we've certainly had some successes, but yeah, a lot of people just don't or won't get it.
Yeah, yeah.
That's it.
So, Dr. Avi, you also incorporate lifestyle changes. We love that as well because we believe that it's not just food and exercise. There's a lot of other things that go with it. And one of the things that I know that you do is functional breathing, because I
Yes.
myself did a course, probably about 18 years ago. I was a bad asthma sufferer from birth.
Oh,
And
wow.
I did a Buteyko breathing course. It was
Yeah.
a bit way out at the time I did it.
Yeah,
And
no,
You
it's good.
crazy person, you.
yeah, and it actually changed my life. Like with that and with diet and some other alternative methods, I'm completely asthma free. In fact, I'd say I cured myself, which no doctor says, you can probably do that. But
Yeah.
I'd had it for, well over 30 years and from a baby. So can you tell us why it's a little bit, why it's important to bring other things into our lifestyle, like the breathing and probably mindset and things like that you do?
Yeah, that's right. I've changed my title on the social media from Dr. Charlton Low Carb GP to Dr. Charlton Lifestyle GP because I've learned so much more about the lifestyle, about other modalities such as stress management and functional breathing and sunlight, circadian health, even stress management and prioritizing sleep and exercise. So I like to talk about all of those modalities, but a special interest on nutrition and functional breathing. The functional breathing or breath work as well has revolutionized my practice as well. Because sometimes there's still some low carb people that they've gone low carb, they've improved their nutrition already, but they have stress and anxiety and they are stuck because they are so stressed, they can't lose weight, they've got lots of things in their mind. And I've trained them with breathing better, with breath work, exercises, Buteyko method that you've talked about, getting to nose breathe, and they've changed their life.
Yeah,
Yeah,
can I tell you,
yeah,
when I did it too,
yeah,
our instructor said you're going to lose a few kilos. And I thought, you've got to be joking because I always, yo-yoed up. It was very hard to lose weight because I was
yeah.
a big carby eater. And I actually lost a few kilos and with just
Yeah,
the breathing, and I couldn't believe
yeah,
that.
exactly.
Sounds
So
crazy, doesn't it?
it
It
does, because
sounds like it's too easy.
you're not exercising more. You're not really reducing calorie in and calorie out, which shows that the calorie in, calorie out model doesn't work.
No, it absolutely doesn't. But lots of
Yeah,
people will argue that point on Facebook.
that's right. So what happened when you lost weight was you might be improving your stress, you might be reducing your cortisol, and so reducing the cortisol, reducing your blood sugar level certainly can help you lose weight and reduce your stress hormones. You might be improving your gut health as well by your mind-gut pathway. And you might be delivering oxygen better to your brain and tissues, that you're burning your fuel in terms of oxygen a bit more efficiently. So yeah,
It all makes
done
sense,
well.
doesn't it?
Exactly. Done well.
So, Dr. Avi, can you give us a couple of examples of success stories you've had with your patients who obviously shall remain nameless?
Yeah, sure. There was a man who had he's done low carb, he's gone carnivore, and he said he's amazing, felt much better. But he snores and he's about 50. So he's been snoring and restless feet, restless legs for many years, and sleep apnea since he was 18. And I've posted a few things on social media that you should be breathing through your nose rather than your mouth. And before he came in to see me and he took up my coaching, before he came in, he started to breathe through his nose. And he felt much better. He snored much less. So he kept reminding himself when he's working and exercising to nose breathe. his wife even said he improved his his snoring by 80%.
Wow, that's huge.
Yeah, so he said this breathing thing has improved his life pretty similar to the carnivore, that how dramatic it has been. So he's snoring less restless legs when you go to sleep. He's sleeping better, more energy, focusing much better when he's awake because he's sleeping much better because he's closing his mouth during the day, which helps him breathe better through the nose at night as well.
And
So yeah.
it is a bit of a, I suppose, something to learn, because I know with me, because I had asthma, I used to gasp through my mouth all the time. And
Yep.
so they got us to actually put a very light tape over our mouth when we went to sleep. And it sort of trained me. But every now and then I might still have to do it because you can sort of relapse. But I just, it's a very light tape. You can easily rip it off. But it's been amazing because, yeah, even when I exercise now, I try and do it through my nose.
Me too. Just
We
to the
want
point where you can still breathe through your nose.
Yeah, most
Yeah.
people want to sort of think they can get more in through their mouth, but it's
Yeah.
much better through your nose, and it makes a big difference.
Absolutely. There's a lady she's about 50 as well. She had lots of trauma as a child and abuse, and she had nightmares all the time. So she suffered from anxiety, and which probably leads to breathing too much, too quick. And I've coached her and retrained her breathing and did get her to do breath work and exercises. So the suggestion is once a day to 3 times a day, 5 to 7 minutes breath work exercise to slow down breathing and breathing through the nose all the time. And after a 20-minute breath work one night, she stopped having nightmares.
Wow.
So
That's amazing.
yeah, so maybe her chemistry wasn't quite right with the breathing, that she probably breathes too much, which leads to nightmares and anxiety. And she managed to slow down her breathing, improve the biochemistry in her blood, and much less anxiety. She can breathe less now and get used to holding on to more carbon dioxide.
I think that's a big thing that I learned too, and especially like, when you do hold your nose and you can actually build that up, which is amazing. Yeah, I just think it's something everybody should know. Like they should teach it in schools, in my opinion, because we just expected to know how to breathe because we just do it
Because
every
we have to do it all the time, every day, our whole life. So
That's right.
sometimes people look at you a bit funny if you talk about learning how to breathe properly, and they're like, well, that's crazy. We have to breathe. So what is there to learn, basically?
What happens is most people breathe too much, just like most people eat too much and too frequent. So if you breathe too much, you're conditioning yourself to breathing off the carbon dioxide too much, and your body can't hold on to carbon dioxide too much. And then you're used to hyperventilating. So low carbon dioxide, because your body is breathed off too much, can lead your body to not getting enough oxygen because of the biochemistry in your bloodstream, in the oxygen and carbon dioxide balance.
And I suppose people could check that if they had one of those little things they put on your finger that checks your oxygen. I know when I visited my doctor a little while back, they put one on there to check my oxygen, and he was quite surprised for my age that, it was about 98. And he was quite surprised that it was up there and not down lower. So that was good.
Yeah, the thing is, most people can get to 98, 99%, but you need to try and retain carbon dioxide to teach your body to not breathe so much.
Yeah, I agree. And what about, has there been any like really amazing stories where somebody's gone low carb and they've got sort of an amazing result when they've tried everything else before. Can you share if you've, got a story about someone that might have gone down
About
that
losing
path?
weight, do you mean?
Yes. Yeah.
Yeah, absolutely. There's a lady who first came in maybe 2 years ago, and she had asthma, she had some injuries, she was quite overweight, and then she was really diligent in coming in every 2 weeks to touch base and check in, accountability. And most of the time we just catch up for 15 minutes. I would weigh her and measure her body. And then over a maybe 6 or 8 months period, she lost 20 kilos.
Oh, yeah.
Fantastic.
Yeah, a couple of kilos every 2 weeks. So
Yeah.
it's not fast, but a little bit of chipping away.
Yes.
And her asthma's better. She didn't need to use her preventers. I wasn't talking about breathing back then. She probably reduced inflammation and improved her asthma that way. And she became more active, and she can go out for walks and bend over without her aches and pains. She's a personal carer, so she cared for her clients a bit more efficiently. So yeah, she was the star patient that kept
You
coming.
must feel
And
so much better.
yeah, absolutely. And
And
all
that, I think,
this,
inspires you to want to do more, doesn't it, when something starts to work?
yeah, absolutely. No Ozempic, no needles, no drugs.
And do you,
That's awesome.
Dr. Avi, do you think that people associate their body fat, especially all this visceral fat that they can put on, with all these health issues? Because we've found that, there's no association with it.
There's a big disconnect between
Mm.
the belly fat and the health issues.
Yeah, they've got no idea. People don't know. They do want to get rid of their belly, but they don't know it is inflammatory. That's not just sitting there. It increases the risk of diabetes. Sometimes they do the blood test and the doctor tells them, oh, you don't have diabetes, but they think it's all good. But whereas they might have a very high insulin level that the doctor hasn't checked,
Yeah.
and their body's just coping, just managing, but a little bit, maybe a year or two down the track, they might be pushed
Things
over
aren't
to
quite so good.
diabetes.
And I think that do you know why doctors don't test for fasting insulin? Because what I've read is that can predict diabetes maybe up to, 5 to 10 years before that person even gets it. But they don't
Yeah,
seem to include that as a standard test, and people wouldn't even know to ask for it.
yeah, exactly. I've never been taught to order fasting insulin back in medical student days. I've only been taught when I went into this low carb space. And there's Medicare has also got a lot of things to tell that they don't want us to order extra tests for funding reasons. And doctors who order extra tests, for example, thyroid functions, vitamin D, and iron studies, have been prosecuted. And
Wow.
yeah, so I got a letter in the mail maybe a year or so ago asking why am I ordering so many of these tests. So we are cautious about not ordering too many tests. And we're taught that if you can't do anything about it, if you don't know what to do, then don't order those tests.
Wow.
Yeah.
That's sort of concerning because, don't you think, I always think prevention is so much better than treatment. I mean, once you've got this burning fire, it's hard to like put it out. But yeah, like if it was
I
a
know.
spot fire, you can put it out quick. And our medical system at the moment seems to just be, treat it, but don't look at what's actually caused it.
Yeah, exactly. I agree. I am totally on your side, and I changed my practice, and I really want to get into the root cause of medical illnesses rather than just giving patients a pill to
Yep.
treat their symptoms.
Absolutely. So, Avi, can I ask how much training on nutrition did you do in your medical degree?
Well, not much at all. I don't remember there was much. Maybe in second or third year biochemistry, I learned about polyunsaturated fat and saturated fat, maybe a little bit. But this is many years ago.
Mm,
Yeah. There are doctors that's trying to change the tide.
that's good.
Yeah. There's Dr. Ron Schweitzer in Melbourne. He was trying to teach medical students about reversing diabetes, and he does talk about low carb. And
That's encouraging.
yeah, he's fantastic. But he's had some trouble with the university administrators, and yeah, so he's gone into a few obstacles by doing that.
Yeah,
I
we
guess that's
recently,
not unexpected.
we recently listened to a podcast where a sports doctor was training other doctors to be sports doctors, and he gave them a nutrition test, and they only got 8 out of 20.
Yeah.
And the receptionist got 7 out of 20.
Oh no.
So they're only one
Yeah.
point above the receptionist who didn't know anything at
Had no
all.
medical training.
Yeah, we definitely didn't get enough. And when we're training in the hospital, there's really nothing at all.
So, Dr. Avi, we're in Sydney. So if we wanted to find someone like you, how do we go
Yeah.
about finding other GPs around the country, I guess, as well?
Yeah, absolutely. There's a Low Carb Down Under, which is the Low Carb Association in Australia. So you can go to Low Carb Down Under website. There's a conference on next week in Melbourne.
Okay.
Yeah, so this is the third Low Carb Down Under conference that I've been into. The Low Carb Down Under website has a big directory of low carb friendly doctors. And I've got friends that are in lots of different states, and we have gatherings on Zoom, and we touch base. We're all connected via social media. Sydney, there's Sydney Low Carb Specialists by Dr. Deepa and Dr. Alex.
So you feel like the low carb GP/GP is growing legs and getting momentum?
Yeah, I think so. Yeah, there's a few GPs in Brisbane that is doing a lot of great work. There's an Australasian Metabolic Health Society, which is not just doctors, but health coaches as well. And they're trying to educate practitioners as well as dietitians and GPs about how to use low carb to improve patients' health. So yeah, there's quite a lot of movement going on.
So do you think the food pyramid will change to reflect what we've been talking about?
It's hard to say. There's Dr. James Mukey, who's the Australian of the Year 2020. Unfortunately, it was locked down and he couldn't go out speaking as much as
Yeah, he's fabulous.
would.
We follow him
Yeah,
as well.
that's right. He was trying to change the dietary guidelines. He worked really hard to try and change it. But not exactly sure if it's political influence or big foods that he couldn't get into the committee.
Yeah, chances are. I mean, we're worth a lot more when we're sick, aren't we, than when we're healthy?
Yeah. But then there's Peter Bruckner, who's the founder of Defeat Diabetes, and he got an association with Diabetes Australia about incorporating low carb into the Diabetes Australia guidelines. So
that's going to happen?
It has happened already.
Wow.
So Diabetes Australia has affiliated with Defeat Diabetes to say that Diabetes Australia is accepting low carb as a modality.
Fantastic.
Oh, that's fantastic. I think
little by little.
Yes. It's so confusing because there was a report on the TV the other night about you probably saw it about, the low carb being a major cause for diabetes. And I know
people will believe that.
And it wasn't reported correctly, and people are confused. So a lot of people just don't know what to believe now.
Absolutely. That study is a Melbourne study. It's a Monash professor who recorded over 10 years, maybe 17,000.
Over 17 years,
Yeah, so lots and lots of people, and they categorized these people into 5 groups. The low carb group is actually not really low carb. They eat 38% of their calories as
So over a
carbohydrates.
third.
Yeah, that's it. So what happens is these people have less carb than usual, but not really low carb, but they have increased their fat intake as well. So they're probably high carb and high fat.
Yeah, and we know what's going to happen when that, combination comes through. It's going to make it even worse. Yeah.
And I actually studied the study, and I looked through all the words, and there's actually a paragraph that said this particular group started off with more higher BMIs and their higher chance of ex-smokers, ex-alcoholics, and lower socioeconomic status. So this is recorded in the beginning of the study.
It's very skewed, isn't it?
Exactly. This is a disadvantaged group already.
Yeah.
And then they found this group have high chance of diabetes, and they're not really doing low carb. And
do you think it's perhaps Big Pharma and Big Food panicking a little bit?
I've been trying to see who wrote this study and if they've got any affiliates, but haven't really found any idea. So it could be that
it's possible.
Yeah, it is possible, but I'm not really looking in the right direction, maybe.
It's hard. It's certainly hard to find, because I sort of did a similar thing, and I thought this has to be funded by someone, and I couldn't track anything down. And so let us all know if you do find out. That would be amazing.
Well, that's a concern in itself, isn't it? If you can't easily find who funded the research.
It's Big Health and Anti-Cancer Council.
Right.
But I don't know the affiliates, how they're affiliated with the Big Food or Big Pharma.
Be interesting to know, yeah. So before we wrap up, Dr. Avi, have you got any other awesome gems, low carb gems that you want to, drop on us before we, finish up the interview?
Yeah. So for anyone who don't know anything about low carb, I would suggest getting rid of sugar and processed food first, and try not to eat so much snacks. So eat 3 meals a day, good meals, try not to snack non-stop. So if you can get rid of the sugar and the processed foods, that is a good step already, and quite often that will improve health. And if you cut down on the carbohydrate intake, that is the next step, and getting rid of the seed oil, vegetable oil, then that'll improve your health fantastically, even without measuring carbs or counting carbs. So that is usually how I would try and tell the patients who doesn't know anything about low carb.
Thank you. That's been great information, and
thank you.
Where some of our listeners might want to actually get in contact with you. So can you tell us how they could actually, get in contact with you or find your clinic?
Yeah, sure. I'm very active on social media. So they can find me on Dr. Charlton Lifestyle GP on Facebook, Instagram, and on LinkedIn is just Avi Charlton. I'm on YouTube as well with lots of videos under Avi Charlton or Dr. Charlton Lifestyle GP. And if they are in Melbourne, they can come to see me face-to-face in Melbourne Low Carb Clinic. If they want to learn about breathing, the company is called Breathe In Health. And if they are interstate, we can do telehealth. If they have a mental health plan, they can now get Medicare rebate under a mental health plan to claim those 10 sessions that you can use to see a psychologist. So this is a brand new thing that I've trained in mental health space, that you can get Medicare rebate with the mental health plan to see me.
Fantastic.
Even with not face-to-face.
Oh, that's good. That's really
amazing.
Good.
Because so many people struggle with, mental illness today, and you can't help but wonder if it's because of what they eat.
It would have to be a huge contributing factor, I would imagine.
Absolutely. Yeah, you are what you eat.
It's true, isn't it?
Well,
Yeah, that's it.
Thanks so much, Dr. Avi. It's been such a pleasure talking to you.
It's been fabulous. Thank you so much, and we really appreciate your time.
Thank you. Thank you, Linda and Vicky. That's amazing. Thanks for inviting me on.
You're welcome.
Our pleasure. Thank
Thanks,
you.
Dr. Avi.
Thank you.
Okay.
Bye, everyone.
Bye. Bye.